I'm Emily Walker, MedPage Today, reporting from Washington. As households across the country open Mother's Day cards and letters over the weekend, the president might have been reading a different letter. This one was sent to him from major players in the healthcare industry pledging to do their part to slow growth in healthcare spending by 1.5% per year, which will save $2 trillion across the next decade, the group said. With healthcare spending growing at about 6.7% per year, healthcare costs will eat up more than 20% of the GDP by 2018, the letter said, which was signed by leaders representing the medical device, drug, labor, insurance, hospital, and physician sectors. The president announced the group's pledge during a press briefing at the White House on Monday.
And that's what makes today's meeting so remarkable, because it's a meeting that might not have been held just a few years ago. The groups who are here today represent different constituencies with different sets of interests. They've not always seen eye to eye with each other or with our government on what needs to be done to reform health care in this country. In fact, some of these groups were among the strongest critics of past plans for comprehensive reform. But what's brought us all together today is a recognition that we can't continue down the same dangerous road we've been traveling for so many years. The costs are out of control.
Following the White House meeting, the stakeholder groups gave their own press conference in which Dr. James Rohack, a cardiologist and president-elect of the American Medical Association, said physicians play a key role in slowing the growth of healthcare spending.
We need to make sure that physicians are there at the table because we know the problems with the 50 million Americans that don't have health insurance. They live sicker and they die younger. We are committed to make these changes, and we were delighted to be there today with our colleagues in the health sector to say what are the things that we can do to improve the value in American healthcare dollar. And you improve value by improving quality and reducing unnecessary costs.
Dr. Rohack spoke with MedPage Today after the press briefing about what cost-saving measures the AMA will try to drive down.
There needs to be a recognition of how do we get liability costs under control, but recognizing that if someone has been harmed inappropriately, that there's also fairness in the system. And so that clearly as we continue the dialogue with the President as well as his administration, of recognizing that if you are going to ask us to reduce variation and provide better care by not necessarily ordering that MRI for every patient that shows up in the emergency room, that if it's not indicated on the guideline and we don't order the test, we have to have that courtroom protection so that we don't wind up then not achieving the total cost that we can achieve.
The guidelines to which Dr. Rohack is referring are AMA-drafted practice guidelines, 148 of which have already received endorsement from the National Quality Forum, which Dr. Rohack says should be the final arbiter of legal protection. Guidelines in the pipeline include measures that deal with hospital readmission, medication use, and cardiac care. Dr. Rohack explains an example of the appropriateness criteria for cardiac care that he feels should be linked to legal protection.
So when is it appropriate to do an angioplasty? When is it appropriate to get an imaging test? Those are examples of saying the profession needs to come up with what's the right thing to do. And if we don't have the right way because we haven't done the science, then that's the reason of getting science engaged by having the randomized controlled trial, the head-to-head matches, the comparative effectiveness research, all the important things that we've talked about that the President understands certainly in the stimulus package with the $1.1 billion in comparative effectiveness research, which is the best way to go. And then once we agree to that, still have ways of innovation. We don't want to stifle that, but on the other hand, reduce unnecessary costs.
So, from the AMA perspective, cutting out those sometimes unnecessary things that physicians do just because it's the way they've always been done could save some major healthcare dollars. It's not clear how the pledge to cut 1.5% every year will factor into legislation, but we won't have to wait too much longer to find out. Senators have been promising healthcare reform legislation by mid-June. From Washington, I'm Emily Walker, MedPage Today.